as a floor nurses don't really get to understand like the day-to-day schedule that nurse practitioners and interns and residents have. We'll kind of interact at different points in the day, but just to get a sense of like what your day entails, talk to me a little about what your normal day looks like for you on the floor.
Okay, so I usually come in pretty early in the morning because the neurosurgeons are going to go to the OR and we need to have a discussion about what the plan is for the patient. So I tend to come in around between 5:30 and 6 o'clock and look at the patients that are on the floor, go through what's happened during the night. I love going in also early in the morning because I talk to the night shift about how was their night, what happened with this patient, especially like the TBI patients, or did they sleep,
Yeah.
So like, how was the patient's night and also how was the nurse's night? So that's one reason I go in really early. And then, so I go through the patients and then we do what we call a sign out at 7 o'clock. And that's where all the residents have already rounded with their attendings. And then they give us the plan from the attendings viewpoint and we can have discussions. So if I have a question about a patient, say, when are we going to restart their apixaban, after surgery? That's the time I can ask that question and then plan for the day for the patients. And then I go see all the patients that I'm taking care of. And then we have interdisciplinary rounds where we meet with PT, OT, social work, case management, and talk about disposition and discharge planning. And then throughout the day, I just see all patients, look at labs, look at any testing that we've done. So if we've ordered a CT scan, then I'll look at the results of the CT scan, talk to families, talk to the patient, give them the results, collaborate with the patients and the families about what their plans are for the day and what they hope to accomplish, their goals. And then we come up with a plan. So, like if it's walk 3 times today, it could be just walking 3 times, but that's like the plan. And then of course, emergencies happen sometimes, hopefully not that often. And I have to say, I feel like we're on top of things a lot, that things are not really surprising. It's very rare that there's a surprise.
Yeah.
But it does happen. And so that can always change your day. But then I mostly try to get patients discharged by a reasonable time. And so that then when the post-op patients, I'm ready for them when they come up. And then it's assessment, going through med reconciliation, talking with families, the patient, and kind of making a plan, like Foley's coming out or not coming out and why, and that kind of thing.
Yeah.
So, and then throughout the day, I'm speaking with nurses to tell them, they're telling me, we're collaborating with the care of the patient. And I'm very, very much in favor of nurse-driven everything.
Yeah.
So it's not me putting orders in, it's us talking about what we're going to do for the patient.
Sure.
That to me is the important thing.
Yeah.
I'm not going to order an enema for somebody if we're not going to talk about it. And you're going to tell me what's been going on. That seems like a silly thing, but it's not a silly thing,
Right.
So just collaborating with that. And then also with my residents, we call running the list. So we run the list about midday to see what still needs to be done as far as any consults or testing. And then before we leave in the evening, we do a sign out with the resident that will be on call during the night so that they're fully aware of everything any concerns that we have about patients, anything that still needs to be followed up on, and then come back and do it the next day.
Yeah, right.